Hey, this is Matt Urtz, the Madison County historian. We're going back and talking to some people we talked to earlier on in the pandemic. We have Garner with us today of SUNY Morrisville. Graham, thanks for being here.
Happy to be here.
All right. So, Graham, when we talked before, we were still very much in the trying to figure out how things were going to go. We're talking in January of 2021. Talk a little bit about how things went and what went well and what you went, oh, we got to change this.
Sure. Well, I think that, like a lot of things in life, it's learn as much as you can and make plans and carry them out as best you can. But inevitably, there's going to be some things that surprise you or that you didn't predict or that happened differently. So, we certainly experienced our fair share of that this last semester in the fall. But actually, we did really well. And I think in most respects, we did better than we thought we would, right? We tried to plan and say, okay, let's be optimistic and let's plan really well. But we also recognize, things can change. And even though some of that happened, I think we were pretty successful.
So talk a little bit about when we talked before, the plan was we want to get to right before Thanksgiving. I think the Friday before Thanksgiving, then we'll send the kids home and they'll do their finals from home. Talk about how that plan worked and what you guys had to kind of change on the fly.
Sure. Well, I think first of all, we were able to actually make it to Thanksgiving. We were fortunate in that we never had to, we didn't have to shut down the campus, send people home or even do a period of remote learning, which we saw plenty of other institutions do. And I think that some of that, of course, speaks to good preparation and good adaptation. And let's be honest, the little bit of luck too, right? Because we saw other institutions who similarly did a lot of hard work and a lot of planning, and then had the misfortune of just being in a circumstance that they weren't able to continue through the full semester. So we are grateful for both the preparation and effort, which was a lot of hard work that went into it, but also, frankly, the good luck that we had too. One significant thing I think that was a source of a lot of change for us was how we managed testing. So I don't know if you want me to go into detail about that, but I'd be happy to
Sure,
talk.
go ahead. Just kind of explain what your plan was and how it changed.
Yeah, so I think it's important to remember that testing was still all pretty new last summer, and there was a question about what kind of accessibility there would be for it. We got in early on the concept of wastewater testing, which is not something that a lot of institutions were doing. And even now, they're not a majority, but more institutions are doing that. And, for those who aren't familiar with wastewater testing, essentially what it is the virus is present in wastewater or sewage, and you can actually detect that people who are sick or even if they're asymptomatic will shed the virus in the wastewater, and there's testing that can detect it, in fact, earlier, right, than other tests might detect it in an individual. And so we had set up wastewater testing at our central wastewater testing plant. We're fortunate that we actually have our own wastewater treatment plant. And I think we're one of, if not the only, at least in New York State, it's not common that an institution has its own wastewater treatment plant. So it's just our population, our campus, as well as Krause Community Center. Initially, we had started with just that central wastewater, and our plan was, okay, we're going to monitor our wastewater levels. And we were, of course, starting at zero, right? Because we didn't have any cases, weren't aware of it in the community. So we figured, okay, if we see the presence of it at all, then that'll tell us where it is, and we can try and contain it more quickly. And that's when we would go in and do, PCR testing or pooled saliva testing. We thought our response would be, keep it at wastewater, and then we'll go and respond with this testing if we see something because of wastewater. Well, what we ended up doing was both. We ended up having the wastewater testing, but then we also started regular weekly pooled saliva testing. And what we did is we kind of went residence hall by residence hall, or groups of commuter students or groups of faculty and staff. And what we found was that wastewater testing would tell us that it was present in a residence hall, and then we would go and say, okay, we're going to let the residents of that hall know that we found it, and the kind of follow-up individual testing that we would do would be 5 to 7 days later. So by the time we were able to take the sample of wastewater, test it, get the results, and then schedule follow-up pooled saliva testing, it was the right period to be able to detect it. And I think that was kind of a little bit anxiety inducing for a lot of people, especially when it first happened, because it was, when it was everyone's first experience with seeing the virus, first experience with seeing any kind of positives. But it was helpful because we were in fact able to kind of find where it was. And sometimes we had positives from wastewater and we weren't able to actually get any positive tests from the students in that hall. We recognize sometimes there was maybe an unauthorized visitor in a residence hall that might have been the source of it, or someone who didn't show up to testing. We worked really hard to follow up and get students to show up for testing, but it's possible there was someone in the hall that we didn't catch. But nonetheless, I think that testing, it showed us how important it is to not just rely on one kind of testing. And I think that's true for anybody, whether it's pooled saliva or whether it's wastewater or whatever else it is you do, that having multiple layers of testing and multiple places where you could look helped us to do something to contain it. And we did have we did have a couple of, I don't know if they qualified to call them an outbreak, but we did have groups, right, where we found out that somebody was positive and there were other exposures and other positives as a result. But fortunately, it never reached a level that overwhelmed us, that we weren't able to accommodate in our on-campus quarantine, or people that didn't, or isolation, or people who were doing that off campus as well. So I'll stop there for a moment.
That's good. That's good. So you touched loosely on it. We didn't have as many issues, at least that we know about here. In surrounding communities, there were some colleges that had very local outbreaks. In fact, a SUNY school to the east of here was forced to shut down because of an outbreak. And then we had other things like a school to the west of us where students actually got busted a few times having parties, and that became a big issue on those campuses. Did you guys have any issues with the students not really following the rules?
Yeah, I mean, our students were great. The students did really well. And I think especially as the semester, it's interesting because I think at the beginning, everyone really wanted to be, safe and careful. And then, this is the double-edged sword of testing, right? When people start seeing negatives, they're like, oh, okay, then there's not a real risk out there. And I think there were probably a few, I mean, definitely a minority, but there were probably a few who let their guard down a little bit. And then of course, we ended up seeing positives. So, and I'm not to say that everybody who's positive that it's because of that, but just to recognize that in some cases, yes, we were aware of students who had unauthorized gatherings off campus, and that's where we saw some issues that we identified. Right, again, not exclusively, and it's not a black and white kind of issue, but I think what we recognized is that we had a lot more influence over what students did when they lived on campus. So we didn't have any real, what I would say are outbreaks so much on campus as we did amongst students who maybe lived off campus, right? And that makes sense because it's, we have less control over their time and what they do and who they're with, even though, we try to hold them by the same standards and same rules. You can see the difference. So I think that's one of the things that we really want to focus on is influencing people to make good decisions, especially if they live off campus, and knowing that, of course, we want people to be safe for themselves, but I think something that we've tried to say from early on, and I think just continues to be more and more true, is that the precautions that we ask people to take are more about being safe for other people than just for yourself, right? Like I wear a mask really because of the other people around me, because I could be carrying it, I could be asymptomatic, I might not realize that I'm sick and I could be spreading it. Whereas if I wear a mask, I contain it to myself. And I think that was the other thing that was really successful for us is I think even before it became really clear and really standardized, is we even during the summer before students arrived, we kept saying, there's lots of things we're going to do, right? We're lots of cleaning protocols, testing, but wearing a face covering, wearing a mask is something that we really want to emphasize as the core thing. If we don't get anything else right, we really want to be emphasizing the importance of wearing masks. And I think that you can see the change, right? From 10 plus months ago, we were all concerned about, wiping down everything and cleaning everything. And while we're still doing that, we recognize that that's less important than what's in the air. And a lot of what's in the air is a result of wearing masks. So I think that's another thing that we really want to, that's a theme that I think existed, but we're going to shift that emphasis even more, is wear that mask and don't gather indoors with other people. That's really critical.
Okay. So that brings us to the next thing. You have this first semester that's pretty successful. Not a lot of cases. The kids go home. They're coming back at the end of this month, at the end of January.
Yeah, so we're actually still trying to solve that, right? We thought we'd be coming back January 25th, and starting with remote only, right? So they would move in before the 25th, but then we would be remote instruction only with a handful of exceptions depending on what kinds of courses, and then go to in person starting February 1st. But based on a lot of other things that are going on, right? We knew the holidays were a potential for a surge. We now see that vaccines are rolling out. People in our own community are getting vaccinated. There starts to be more and more of an argument for us to say, can we hold off starting for a couple more weeks? Because those couple more weeks could buy us some really precious time. So we're looking to see if we might be able to start just a little bit later than the 25th. We're kind of looking at February 8th, and that's what we've proposed to SUNY system tentatively. Sounds like they're having discussions, and we should hear something back early next week. And to my earlier point, right? So much of this is about, you develop a plan, but then you have to be able to adjust, right? I think it's hard because it's like you have to be dedicated to planning, but you also can't be so rigid about your plan that you don't adapt to changing circumstances. So keeping both those things in your head, right? Like have a plan, but also be ready to adapt. And so working on both those tracks, I think, is really critical for us. And that's what's happening right now with talking about our start date.
Yeah, and so Eaton's is pretty high up the list in the terms of the town's cases. They had a pretty good spike a few weeks ago, and they seem to kind of have gone back down. But you are bringing them back at a time where we're seeing record number of cases across the country. Although that's again across the country. So it is different because before there wasn't a ton of cases here. Now it's everywhere. And that is a little bit different, and it does seem to change. The other thing that's happening, and you kind of mentioned it, the vaccine is rolling out. So what happens if a student's eligible, but they have to go back home to get the vaccine, or will it be made available more on a local level as it's available to that group of people? Obviously, right now it's being rolled out to medical professionals, and seniors will get it first, but has there been any talk of something like that?
Yeah, I mean, that's a good question to ask. That's a good topic to bring up. And I think that's one that, shows a little bit of a contrast between the fall and the spring semesters, right? So, we went into the fall with 0 cases, 0 presence of the virus, nobody on our campus that we were aware of had COVID. We weren't detecting it anywhere. And then people started to have cases, and it's interesting because we didn't see it amongst our faculty and staff while our students were here, but then at the end of the semester, about the same time that students went home, were the first time we saw cases amongst our faculty and staff, around Thanksgiving and following that in the holidays. So the prevalence in our community went up about that time. And so now we're starting a semester, and we started to see this toward the end, right? We had the earliest students who had cases, they completed their isolation period, and they were authorized to come back to campus and live on campus. And so they would come back, and even though they were recovered, they could still continue to shed the virus, right? So now that's in our wastewater. We could detect that in our wastewater, even though that didn't mean that somebody was actually sick. So we've also had to adjust in how we read that testing data. So we're now starting a semester where we know we're going to have students who come back who had COVID and who recovered. And so they're going to have some level possibly that's going to be in the wastewater. And so we'll have to interpret that. There's some advice about if you've had COVID and recovered, should you participate in pooled saliva testing, for example, like how accurate is it in detecting whether you have a case again, which we know is not likely, but can happen for people. So a lot of what we're doing right now is adjusting to the fact that now there's a number of our population who have had it, but have recovered, and how does that affect what we do? And so related to vaccines, we've been really lucky because we worked with the Madison County Department of Health, who've been amazing. And I look at what they've had to adapt to, right? So you think about what they were focused on back in the summer and the fall. and being able to do contact tracing, I think that started off as something that was manageable. And by the time we rolled around to December, it was huge, right? And we would see reports about where someone was in the county, if they were at a store or a restaurant, and we'd get reports, and that came to a point where, there was just too much of that. And the notice was, you just need to assume that if you go out of your household, you're being exposed to that. And so we similarly had to recognize that on our own campus, right? And even in the midst of that, the Department of Health was planning for a vaccination plan, right? Like, how are they going to roll out vaccines? And they were talking regularly with us at the colleges, and we've been involved with some of that, things about storage and distribution sites. And so we've been fortunate to be a part of that conversation, and we continue that. So our hope is that we continue to help with the community, and that helps us in the planning. So when it's the appropriate stage for example, students to be vaccinated, that we're able to coordinate that appropriately. Most likely, I would expect that we'd want them to stay put, right? Because one of the big things we don't want is people traveling around. We want people to limit their movement as much as they possibly can. So, for example, if I can continue.
Go ahead.
One of the other things that's similar to what we did in the fall, we ended before Thanksgiving, in part because we don't want people to go away, go home for the Thanksgiving and then come back and then go away again. Like, that traveling is a risk. So one of the things that we did this spring is we eliminated spring break, right? We don't have spring break. We're going to have the same length of a semester, right? You get the same amount of instruction, but the calendar wise, it's shorter period, right? We'll end a week earlier on the calendar than we otherwise would, because we don't have spring break. We really want to eliminate those chances that students might go away and come back, recognizing we already have some of that that's going to happen, right? Students who work, students who do go home on the weekends where they live, but we're just asking our students to stay put as much as they possibly can.
So real quick, are you guys doing sports this year, or are sports completely off?
So that's a good question, right? There are some sports that we know have been canceled or at the very least delayed. Right now, we don't have anything on the calendar that we will be moving ahead. And so we're in constant contact with and consultation with our conferences, and trying to follow their guidelines, as well as the NCAA, along with the state and SUNY and whatnot. So there's a lot of different kind of coordinating entities. We don't have anything that I would say is for sure scheduled right now, and we're just going to continue to try to adapt. Everyone remains hopeful, everyone tries to be prepared, but we just we can't say definitively that we are or completely are not. I think we're trying to prepare ourselves for that
Possibility.
it's a hurdle to try and do anything like that, and obviously safety has to be the most important thing.
So one last question, and it's probably the hardest one to answer. Are you going to require vaccination to stay on campus?
That's a good question, right? I mean, we already have some requirements even before the pandemic. There are vaccination records that we require students. Most commonly we think of MMRs, measles, mumps, and rubella. We require students provide proof of the vaccination. There are some very limited exceptions for that, but we've required that before. So there's reason to expect that something like that could follow for COVID. I think that that's something that's likely to be decided, at the SUNY system level, which is going to be informed by the state, and potentially even federal policy, right? I think we're most likely focused on what the state's going to require. So I think that we watch those conversations, and Morrisville's not going to be alone, right? I don't think that's a decision that we would make on our own. It's most likely going to be consistent with what the system.
Yeah, and that's the other places I've talked to have been the same thing. It's kind of like, yeah, it's something we're talking about, but we don't have the answer, and that's fair.
Well, and it's also interesting, right? Because in Madison County, we're talking about 3 institutions of higher education, right? And 2 of them are private institutions, and 1 of them is part of the SUNY system. That's us. Yep. And so it really is a little bit more on them what they decide, unless the state just mandates it, regardless of whether you're a private or public institution. But even more so for us, it's even more out of our hands than maybe for others, because we're part of a system, and we want to make sure that the system itself is strong. We're lucky that we're part of a system that's helped us participate in SUNY Upstate's pooled saliva testing, as well as the wastewater testing. So Quadrant Biosciences, that is with SUNY Upstate, has made all of that possible, which has been a huge thing for us. That's been monumentally helpful, and yet another reason why we're really glad to be where we are and have the partners that we have at the county level, at the system level, and in state and beyond.
Anything else you want to add?
just that we're really grateful, right, for our support in the communities. And I would just kind of reiterate what I said earlier about the relationships. I think the relationships we have as individuals, the relationship we have as entities in our communities is really important to get through this, especially when it's scary and it's hard. I think we have to be open with each other, honest with each other, share information, share the truth, and also be patient and helpful as we can. I know that there's been plenty of anxious moments for all of us over this past year, and but those have been made, I think, made more manageable when we have tried to share information and work together and believe that we have the best of intent for our communities, and we're sure grateful for that.
I can't, once again, I thank you for taking the time to talk with us today. We'll probably reach out to you again one more time at the end of the semester. And hopefully by that point, we're talking about everybody being vaccinated and it kind of winding down, but we shall see.
Yes, indeed. A hopeful and optimistic year, I think.
Yes, yes. Please be safe. And we wish you nothing but the best. And again, thank you for taking the time.
You as well. Thank you.
Yep. Bye now.